So I come as president and co-founder of Citizens Council for Health Freedom. Our organization has been around for 25 years, two different names, but 25 years, and I have run this organization since the very beginning. And we have dealt with privacy since the very beginning. The purpose of our organization is to protect individual control over healthcare decisions, to protect individualized patient care, and to protect medical and genetic privacy, because we say, he who holds the data makes the rules. Now, you were talking about a joke, right? Doing a joke and someone's going to keep their day job. And our co-founder, the other co-founder, passed recently, but at his memorial service I found out that when he gave speeches, which I never heard him do, he said this. He said about making speeches, he said, conception is easy and delivery is hard. However, in this case, delivery of this speech is not difficult at all, because this is a book that I wrote. I spent 6 hours, right? Oh, I wish I spent 6 hours writing the book. 6 years writing this book to try and tell the American people what they need to know about what is happening in the exam room. So I wanted to show the whole picture. I wanted to, I mean, a lot of people, when you think about healthcare, you think about whatever you think about, right? But you may not understand really what's happening in the exam room under your nose that's impacting the way that your doctor takes care of you, that's impacting why they ask you certain questions, that's impacting how they look at you. And a lot of it has to do all with the data. So for 20 years, essentially, our organization has been fighting both Republicans and Democrats on this issue. Because although sometimes, you know, we have Republicans or Democrats who really see eye to eye with us, but again, we say he who holds the data makes the rules. And then the exam room, there's a lot of data collection happening. And both sides are pushing data collection because they think it's good for public health on one side, and the other side they say we need to find out who the best doctors are. We need to have doctors who know completely about their patients so that they can take care of them. But of course that's not what the doctor is supposed to do. The doctor is supposed to treat you when you come into the exam room, not to monitor and surveil your entire life, profile you completely, figure out predictively what may happen to you in your future, try to intrude on your life in order to keep that thing from happening to you in your future, gathering your genetics to try and figure out how much of a burden to the healthcare system that you are. That's what's taking place in the healthcare system today, and I wanted to tell why and how and where it's leading to. So I wrote this book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records. You'll notice it's a very thick book. It has about 80 pages of endnotes, more than 1,500 endnotes, because it had to be bulletproof. It had to be in such a way that the American people wouldn't say, well, where did she get that from? You know, how does she know that, right? I wanted them to be convinced about what I was saying. And indeed, a physician recently wrote on Amazon saying, I use electronic health records all the time, but I had no idea. And so that's, you know, that's what this book is meant to say. Now, the book has recently gotten an award from Reader's Views, and it's a Reviewer's Choice Award. And so, and so, but what the reviewer said is what I liked the most. And at the very end of it, she said everybody should read it. And Cato Institute did a review on it, and at the very end of it, they said everybody should read it. And of course, I think everybody should read it, because I want you to never think about the exam room however you think about it today. I want you to go in fully armed and engaged with what's happening behind the scenes in the exam room. I want you to not I want you to not fill out the questionnaires or only fill out the answers to why you are there that day. I want you to be careful with the iPads that they give you. I want you to cover up the little camera in the iPad, because I have a little story in here about somebody saying, well, clinic should take a picture of you as you fill it out, right? I want you to be armed and engaged, and I want you to understand what you need to ask your doctor when you're there, because your doctor is being controlled by the electronic health record all too often. So let me just give you, so it's a big book, right? But let me just give you a few points. I want to tell you a bit about the history, about the impact, about the ultimate goal, how we get out of here. So that'll kind of sum it up. So the short and sweet history of this is that I'm just going to start with Hillary Clinton. But I do want to tell you that there's a timeline at the back of the book, starting with 1942, I believe, with the War Board during the World War II, and their decision to move people into, or to allow employers to offer employer-sponsored health insurance. And that is the beginning, because the reason why we're here today with where we are in healthcare and why we have this push towards electronic health records and why outsiders are trying to control the doctor in the exam room is because of third-party payment. Third-party payment for care means all those third parties have decided that what happens to you in the exam room is their business. What happens to you, they should be able to have something to say about it. They should be able to tell the doctor how to practice. They should be able to stop you from coming in when they don't think that you need to be there. They should be able to limit what doctors you see. All of that sort of thing should happen because, or they think it should happen because of third-party payment. So I have an entire timeline of how we got to third-party payment control of the exam room, year by year by year, and I list the bills and I list what they did, and so that also is a resource for all of you. But the short and sweet history of where we are today, I think really starts with Hillary Care. Hillary's bill had several things, which, as you know, or many of you might know, it failed. Right? But it had several things. It had a national medical record system. It had HIPAA. So the HIPAA that we have today is right out of her bill. And it had practice protocols for physicians and other practitioners. So the government wanted to issue practice protocols, how doctors and others should practice, and then the National Electronic Medical Record System would track compliance, and then payment would be according to compliance with the national protocols for practicing medicine. So that was all in Hillary's bill. And Hillary's bill failed. So it failed in 1994. In 1996, along comes HIPAA. It took the administrative simplification part of her bill and put it in there. And that's why you sign that acknowledgement that you have received the notice of privacy practices. That's why everyone today can have, not everyone, that's a little too broad. That's why 2.2 million entities can have access to your medical records without your consent. That's why here in Minnesota there are businesses and the hospitals and the health plans who all want to get rid of our Minnesota patient consent law, because it's stronger than HIPAA and they can't access our records like they can access it in the rest of the country, and so they want to get rid of it. And so our organization has been fighting against that. We're trying to protect you from HIPAA. Okay, so that was all in Hillary's bill. Hillary's bill also had quality measurement. So doctors would be measured according to their quality. And of course that takes data. But it's really compliance measurements. It's compliance with the doctor with how they want medicine to be practiced. So all of that from Hillary. And then along comes HIPAA in 1996, and we get these national standards for sharing data. We get these national data fields, the numbers, the protocols, all of that for the actual data. And then we get all of this access from outsiders to our electronic health, to our medical records. But of course, what would make it even easier is if it was all electronic. And HIPAA allowed it to be electronic, allowed your data to be put into an electronic health record without your consent, because it allowed all this sharing. Before that, the doctor would have had to ask for your consent, but HIPAA said it wasn't necessary anymore. But most doctors and most hospitals did not have electronic medical records. And so 4 weeks after President Obama was elected, the Recovery and Reinvestment Act was passed, and in there was another act called HITECH, the Health Information Technology for Economic and Clinical Health Act. And it mandated the electronic health record on penalty of for every Medicare patient. So if the doctor or the hospital doesn't have an electronic health record that is certified by the government, that complies with the way the government wants the electronic health record to be, then the physician is penalized, the hospital is penalized for every Medicare patient. So that happened. And then the Republicans in 2015 embedded it, strengthened that requirement, and created some new systems through a law called MACRA, which is the Medicare. I always have to think about this one. Yeah, Medicare what? See, you know, we get so used to using our acronyms. Medicare something and Chip Reauthorization Act. Anyway, and I can't believe I can't think of it. Anyway, what it said was that it made the penalties even stronger for not having electronic health records. And it created 2 new payment systems all attached to the electronic health record. Okay, so as I said, Democrats and Republicans together moving us towards a surveillance system in the exam room. And so today, almost every hospital in the entire country has an electronic health record that meets the federal government's requirements. And the requirements the Republicans put in required using the electronic health record to report data. So this is just growing. Okay, so what's the impact on doctors? So doctors are very unhappy. And I would recommend that you ask your doctor. Just ask your doctor. The next time you see any doctor, say, what do you think about the electronic health record? And just listen. And then if you care to, come onto our website and share the story of what your doctor said. Because the doctors hate it. Their productivity has been cut almost in half. They are spending twice as much time on the electronic health record as they are with patient care. It is considered the main cause of physician burnout. At least 53% of physicians now say that they are burnt out. 48% of 17,200 physicians surveyed said that they are looking to leave the practice of medicine. 48%. At a time when Medicare folks or Americans are entering Medicare at $10,000 a day, so probably getting into the most critical time of their medical life, and physicians are wanting to leave the coop because this is not what they signed up for. They didn't sign up to be data collectors and data reporters. And one doctor that I quote in the book talks about how he gave up the practice. He gave up his 3,000 patients, and because he couldn't tell them what was happening to the data. He couldn't say how it was being used, and he felt it was unethical. Patients are, okay, let me ask you a question. How many of you have seen a doctor and felt something different than what it used to be like before the electronic health record? Do you see the heads of the back of the heads of the doctors? Do you see different questions? How many of you have found errors, like they say, are you still taking this or still doing that? Yeah, so so I have an entire section in here about how there are so many more errors in the electronic medical record, and once there's an error in, the data goes all over. It's very difficult for you to correct an error. There are deaths that have been caused by the electronic health record, and the FDA agrees and says injuries and death have happened. So I have statistics in here. I have a few tables in here, just showing what's happening. See, this is a patient safety issue. This is not just a patient privacy issue, it's a patient safety issue. I had one physician tell me that he has given up. He has given up looking for the nurse's notes. Now, I'm a nurse, and so I used to write things. I'd write a summary, and the doctor would read the summary of the patient. I was an ER nurse, read the summary of the patient, and then take care of the patient, right? This doctor has given up looking for the nursing notes because it's just too many screens to look through. Another doctor told me that when she wants to order a certain whatever, right, she has to go into the field, and you know how this goes. The menu, right, it goes down. It's 250 things in the menu. She's got to find the right one with the right code that fits exactly what she needs for her patients. And this is one of the places where errors come, is because they think they clicked on the right one, right, but they didn't. And they're working really fast because their productivity has been slowed down, and they're just feeling like they're click, 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 click. I have a quote in here where they call it clickeria. So the doctors, they really just want to get out of this. Patients are dealing with a doctor who doesn't touch them as much anymore, who doesn't look them in the eye as much anymore. They see, so many patients complain about seeing the back of the head of a doctor. There's a child who was coloring in the room who has a picture of the doctor facing the computer and his mom sitting behind. Right. On privacy, of course, this is terrible because it makes it so easy to share all of the information. There's no end to the sharing. There's no end to the profiling. They're doing what's called population health. They want to get an entire profile of you so that they can know the entire population. They want to move away from individualized patient care to population care. So the doctor takes care of the population instead of the patient and thinks about the rest of the population before ordering for that patient. So that's really a socialization of the practice of medicine. And on costs, I have an entire chapter on costs. So there are so many costs. A paper medical record was a paper medical record, and pieces of paper, and a chart back and a chart front, and a pen. But now, doctors, because of the cost, have given up their practice and become employees for hospitals, because they can't afford the cost. They can't afford the cost to buy the system. They can't afford the cost to maintain it. They can't afford the cybersecurity problems, the updating, the connections. To connect, sometimes to connect just to the laboratory is a $10,000 connection fee. There are all of these connection fees that they have to have, and they never used to have those before. So a lot of them have just sold their practice and become employees, and now they're under the control of the hospital or the big clinic system or whomever. So this is a really big problem, and it's all caused by the whole medical system is being reshaped by the electronic health record. And the ultimate goal is a national electronic medical record system that allows outsiders to control the doctors, allows outsiders to put non-physicians in the exam room that just follow the treatment protocols in the computer. And in the book, I talk about how the CDC had some researchers looking at treatment guidelines, and they wanted to force the doctors to follow the guidelines that they came up with, rather than whatever the doctor wanted to do. They want to essentially turn doctors into technicians so that others, non-physicians, would do all the primary care, and surgeons would do the surgery. I have some stories about how that goes, but and so at the end of the day, it's socialized medicine. And so one of the things that I have said is, if you socialize the data, then you can socialize the doctors. If you put the data under control, if you have outsiders having access to the data, using the data, then you can socialize the doctors and socialize the entire healthcare system. So some ways to get out of this situation that we're in is by looking at the root. And of course, the root is third-party payment. And so we must leave third-party payment behind. And I realize that third-party payment started in 1942 and Medicare in 1965. And the employer-sponsored coverage, the Federal Employee Health Benefits Program, Medicare, Medicaid, Obamacare, VA, all of these are all third-party payers. making the entire healthcare system expensive. So steps out, there's an entire chapter with steps. Steps for Congress, steps for state legislators, steps for you as patients, and steps for practitioners of what to do. Just go through your list and find 2 or 3 things that you want to start with. One of the things I tell patients to do is to ask the doctor, are you giving me this treatment because you think it's the best thing for me, or because this is the protocol in the computer? Get the doctor to tell you what's really going on here, because they're being forced to follow protocols. We need to move to direct payment, so third-party free practices, cash payment to doctors, cash payment to radiologists, cash. And then we need to have indemnity policies. Catastrophic coverage needs to come back. The Affordable Care Act, I don't know if you realize it, the Affordable Care Act prohibits the sale of catastrophic coverage to anyone over the age of 29. So you can't, an indemnity policy is true insurance. Health plans are not true insurance. Indemnity policy pays you, and then you pay your doctor and your hospital. So a guy who is in his 80s told me that in the 1970s he had to have heart surgery. And his indemnity policy sent him a check for $68,000, which he used to pay his doctor and his hospital. And he said, it was simple. And it is. Those third-party payers are making money, lots of money, off of being in the middle. They're the middlemen, those health plans. And we need Medicare freedom from Medicare, so that individuals can actually buy insurance for a lifetime. Why can't they buy insurance for a lifetime? Well, and why couldn't parents buy insurance for a child pre-birth and hand it off to the child at maturity? And then the child takes it wherever they go. No golden handcuffs to your employer, no new pre-existing conditions because you lost your employment, no pre-existing conditions because you lost your family coverage, complete ownership of your portable policy to take it for catastrophes wherever you go. Medicare freedom, on your chairs or wherever you happen to see it on your table, there's a petition. We are petitioning President Trump to do what is so easy for him to do. What the Clintons did is they put language in the Social Security Administration's Procedural Operations Manual. And that says that you cannot have your Social Security benefits unless you enroll in Medicare. That is not a law. That is not a rule. That is just something that the Clintons did. And the Social Security Administration has been following it ever since. It also says if you disenroll from Medicare because you can't stand how it is rationing your care, you must pay back all Medicare and Social Security benefits that you have received to date. So if 10 years into Medicare you decide this was a really bad idea and you want to disenroll, you'll pay back everything for those 10 years. Every Social Security dollar, even though you earned it, even though you gave it to the government from your paycheck. So the best way to do this is for Trump to undo what the Clintons did. It doesn't take an act of Congress, it just takes an act of the administration. Our meetings with the administration are moving up and up and up. We have delivered 1,500 petitions to the White House, and we want many more petitions to come. So if you can sign that petition, hand it to me on my way out, which I'll be leaving in probably half an hour. If you can give this to your friends, you'll see that there's an online version of it. You can send them a link. And if there's anybody who knows anybody in any other libertarian party around the country who can get this going in that libertarian party, that would be great. So, oh yes, and then we also have the Wedge of Health Freedom. It's our encouragement to doctors to go free of insurance and free of government. Not sign any contracts with insurance, no contracts with the government. Go cash, check, or charge only. You can find it at jointhewedge.com. There are about 11 practices in Minnesota so far, but we have almost 400 around the country. So that is it. And the last thing I'll give you to help you in the exam room to not sign the HIPAA form are these little cards. If you want a little card to show to your doctor about why you do not have to sign the HIPAA form, feel free to come and get one from me before I leave. That's it. Is there any questions? Yes?
In my last physical, they asked me 3 questions that I refused to answer, which I probably should have then given them a porcupine sticker to put on my record or something. They asked me, do I do recreational drugs? Do I have guns in my house? And do I feel safe in my personal relationships? Is that a Minnesota thing? Is that a federal thing? Why were they asking me those questions? And again, I said, it's none of your business. Take my blood and test that. But where does that come from?
That comes from population health, wanting to completely profile you. It comes from predictive analytics. They want to be able to predict what your future is according to who you are and what they know about you. So don't answer questions about your family either would be my recommendation. And now they're doing what they call social determinants of health, SDOH, social determinants of health. And they're actually coming up with a code for these things. So they have a code for do you feel safe? And so they'll be able to take everybody's on that one code and be able to see everybody who does feel safe and everybody who doesn't feel safe. It's all profiling.
Is that federal then that came from, or is that state?
It is both, because the Affordable Care Act really wants this kind of population health, this movement towards population health, but there's all sorts of movement towards population health for many reasons. Any more questions? Yes.
Do you have any idea where the Trump administration stands on this? Have you gotten any response to date?
Yes. So as I was saying, we actually have been meeting with the Trump administration and moving up the ladder in decision making. So it is our hope that eventually this will happen, and we need it to happen before Trump gets out of office, because we don't believe there'd be any other president willing to do this. Yes.
I'm sorry, I'm not sure if this was covered, but I just wanted to ask, you said you had an online petition.
Mm-hmm.
How do we access that?
Go to cchfreedom.org, cchfreedom.org. I was thinking it was written at the bottom of the petition.
Oh, yeah, here it is. Thank you.
Oh, nope, it's not on all of them. I can see that. It's not on mine. It should be there. Sorry about that. cchfreedom.org. Yes?
I'm almost afraid to ask, but I suppose you probably have a story about what happens if somebody does answer the question about whether they feel safe in a relationship.
Did you say no?
Yeah.
Well, I don't have a story. But I wouldn't do it, because there are so many things that they can compile about your life and use that one little piece. And what does that mean? And then somebody might ask you, well, what does that mean? And every word, that's another thing I talk about in here is the scribes, right? Because doctors actually want to talk to their patients, and they want to touch them, and they want to look them in the eye, and that's the best history that can be taken when you do that. But because this is just so baffling and so much administrative work, they've brought this third party into the exam room, which is another really bad thing about this mandate, and that's the scribe. So every word that you say is being typed into the electronic health record, and under HIPAA, not in this state, but under HIPAA, all of these people could have access to that data. Whoever your doctor, your clinic, your hospital wants to share it with, for whatever reason they want to share it with, they can have access to that data, and all sorts of people could find out you don't feel safe and they don't know why.
So it's certainly safe to assume they're not asking the question to be helpful.
The very best thing is, so like you didn't answer 3 questions, right? Which makes them wonder about those 3 questions.
Now I'm tagged as a troublemaker.
Right, so it is better just not to answer the questions. What I often say is, I will answer what the doctor needs to know when I get in the exam room. And I once was given an iPad, and I was okay with like maybe the first 5 or 6 questions, and then it got into a question I wasn't okay with, and I said, I'm not answering any more questions. And they said, well, we can't check you in until you've finished. And of course, you can't just skip the question you didn't like. You have to answer it. And I said, well, I'm not answering it. And so then the manager came out, and they figured out a way to bypass it all, but only because I pressed. And so it took me an hour extra in that appointment before I could be seen. So you really do have to fight for this, but it's really fighting for your freedom. Fighting for your privacy is fighting for your freedom. And if you don't understand that privacy is foundational to freedom, Just think about how Stalin was having all sorts of people report on their parents, right? Children were reporting on their parents. Surveillance has to happen in a system that's not free. If you don't want people to be free, you conduct surveillance. And that's what happens. And this is surveillance in the exam room. It's not only to profile you, but it's to control your doctor and to socialize the entire healthcare system and put it under the government and the health plans who are running it for the government. But there are things to do, and we are doing lots of things to try and basically build the system out here to collapse this system. That's what the wedge is all about. That's what bringing back freedom, the option to opt out of Medicare. Why did the Clintons put it in there? Because they didn't want you to opt out of Medicare, right? So we're breaking down the system and moving back to freedom. Thank you so much. Oh, go ahead.
Do you have a lot of support in Congress for this, like House and Senators?
Oh, thank you so much for asking that, because on April 4th, Senator Cruz introduced the bill to do the very same thing. It's called the Retirement Freedom Act, and he has Senator Rand Paul and Mike Lee on the bill. And then Representative Gary Palmer from Alabama introduced it and reintroduced it, and last year he had 7 members on, and we're working to get more than 7 on. However, that said, that is not the way to make this happen. You know, legislation takes forever or it never happens, right? And so the way to make this happen is just to have Trump say to the Social Security Administration, delete that language, or executive order it. One or the other. The Clintons did none of that. It just appeared.
I'm sure it'd be pretty helpful to have representatives bring attention to the issue.
Exactly right. Exactly right. That's why we asked them. This was actually DeMint's bill. Dick Armey was a plaintiff in the lawsuit trying to get that language out, and the Supreme Court chose not to take it. And after the Supreme Court chose not to take it, Senator DeMint had the Retirement Freedom Act. And so we have asked Congress to resurrect it. They did it about a year and a half ago, and they have done it again. Now with more people signing. Yeah.
I have 2 questions related. The first one you said in the book is plans for not just individuals, but for what legislature should do and all that kind of stuff. All right. Second, you weren't here earlier, so I'm running for the vice presidential nomination for the Libertarian Party. Can we, if we read that over and like it, and as long as we credit you, can we put it on our website and say that's what we recommend?
Yeah, as long as you credit. Yep, that is great. I am more that, you know, this is all about ammo. So making it happen.
How many signatures do you need? Just as many as possible, or is there?
Oh no, I think it's as many as possible, because we're just like on a campaign. So now we have a letter to Trump. It was signed by 37 organizations around the country, co-signed by 37 other organizations. And now we have 5 more organizations that have co-signed it. And I'm working on 2 other people who probably aren't going to sign it with their organization, but everybody knows them in the Trump administration. So we're pressing. We're just pressing, because our concern is if Trump doesn't get reelected, right? We want it to happen while he's in office. So, okay, so I'll tell you one thing about the book is I have 9 here with me. They're $20 tonight, just straight $20. I do have 9 extra in the car in case there are more people than 9 who want them. And then that's it. Then I don't have any more with me. So, thank you so much.
For a long time, we were